Just give it 10 seconds or so. Okay, you're live.
Good evening, everyone. Hope you're out there. I can't see you, so I hope you can hear me okay. Just put a message in your chat if you can't. Good evening, everyone, and welcome to the Weoley and Selly Oak Ward Forum. Myself and Councillor Johnson are here, and we've got a few people doing presentations. We've got COVID, Clean Air Zone, and we've also got something around the Census as well that's coming up. Just a quick notice, this meeting is being recorded and will be available online. For the next year or so, will be available online to view through the link to the meeting you've already had. Otherwise, it will be put up on YouTube at some point once we can get the technology working properly. But if you put questions in the Q&A, we should pick them up towards the end. But I'm going to bring in Justin Varney straight away, who is the Director of Public Health in Birmingham, and is here, has very kindly agreed to talk to us about COVID this evening. Hi, Justin. Good evening.
Hi, Councillor Chatfield. So I'm going to give you a brief overview of where we are in terms of COVID across the city. I'll talk a little bit about specifically the situation in Weoley and Selly Oak, and then happy to take any questions. So what we're seeing in general across the city at the moment is that the case rates are coming down. So the case rate up to the 9th of February over the previous 7 days was running about 257 cases per 100,000, which was a drop of about 30% compared to the previous 7 days. What's good news is we're seeing the case rates in the over 60s now lower than the case rates in the under 60s. But the highest case rate remains in our working age population, that group between 30 and 34, but is particularly high at the moment. And when we look at the distribution on ethnicity basis, we see the highest case rate in our Pakistani community, followed by our other Asian communities, and our lowest case rate being in our mixed ethnic community. And also we now have data based on deprivation, and what that's showing is that we have higher case rates in our more deprived communities, and that very much reflects those are the communities in which people are unable to work from home and have to continue to go to work and therefore remain exposed. And that's why we're doing a big focus on encouraging employers to ensure that their behaviour is COVID safe and they're supporting their staff to be tested regularly. Just to reiterate, there are 3 types of tests for COVID. So the first is the antibody test. That's a blood test. That tells you whether you've got antibodies or not. You can only access that privately or if you're part of a research study. Frankly, it's a bit of a waste of time because we know that even if you've caught COVID, your natural immunity wears off after about 4 to 5 months. And if you've been vaccinated, we can be very confident after the 2 doses, you will develop antibodies. So frankly, don't waste your money on the antibody test. In terms of tests for COVID infection, there are 2 types of tests. Both at the moment involve a swab to the back of your nose or the back of your throat. The one gets sent off to the lab, that's the PCR test, and that we use for testing people who are symptomatic, because it's very, very good at finding even tiny bits of the virus. But it's expensive, it takes time, and that's why we don't use it for everyone, because we have a limited lab capacity to be able to use it. And you get that test by ringing 119, and you either go to one of the testing sites or you get a postal kit. And that test is very good at finding very small amounts of the virus. The third type of test, same swab to the back of your nose, back of your throat, but instead of going to the lab, that's used in a lateral flow test, which is the one that's done at the testing site and gives a result in about 30 minutes. And that's looking for the virus protein, and it's very good when there's loads of virus on the stick. So it's most effective at finding people who are infectious but may not have symptoms. So we're using that test at the moment. Anyone who is leaving their home to go to work, or because you're in a care bubble, you can access these tests through the community sites. There's lots of information on the council website about where you can get these tests for free. And you should be testing every 3 to 4 days regularly if you're still going to work. If you're in a care bubble, so you do say you're shopping for your mum, on the day you do your shopping, go and get the test, because it's an extra bit of safety to know that you're not infectious, even if you don't have symptoms, on the day that you're popping in to drop the shopping off. Unfortunately, like every other test in the world, it's not 100% perfect, so you still have to keep going with hands, face and space. I'll touch briefly on vaccination. So vaccination's led by the NHS, and we're working closely with them to support the comms and engagement. We're rolling the vaccination out across the 9 priority groups, and these are the groups that are people who are most likely to die or ending up in hospital if they catch COVID. When we've only got a limited amount of the vaccine, we're giving it to people to stop death. We're not giving it to people really to stop transmission. And that's why, for example, teachers aren't prioritised, because at the moment there's no evidence that teachers are any more likely to die than any other professional groups. So we're prioritising it to people that are more likely to die or are working in very close contact with them, like personal care workers, for example, care assistants. The groups keep getting opened up more rapidly because actually it's all going really quite well. And just this week, they've opened up to people in priority group 6. And that means people who have what we call moderate clinical risk factors. So, you know, there were the people that were clinically extremely vulnerable. Those were the people of shielding. There's now an additional group of people called moderate risk, and that includes, in general, it's the people that have the flu jab every year. It's not a perfect match, but it's a lot of them. So it's people who've got chronic asthma, chronic airways disease, diabetes, chronic kidney disease, people with a body mass index of over 40, for example, people who've got conditions that affect their brain or nerves, such as cerebral palsy or multiple sclerosis. All of those people are now eligible for the vaccine and can book an appointment without waiting for a letter from the NHS. So that's one of the changes that's happened this week. And the NHS is opening up more vaccination sites across the city to try and make it even easier for people to get a jab. Once the 9 have been done, the 9 priority groups have been done, then there'll be a discussion about how the rest of the population gets prioritised. And that's where I think there is a stronger argument for teachers, bin men, for example, to be more near the front of the queue with policemen and fire service, etc. But until we've got those 9 priority groups vaccinated, every vaccine needs to go into the arm of someone whose chance of dying is high to prevent that death occurring. So that's where we're going on vaccines, and there are a whole series of vaccine conversations the council's organising, and I'm sure Councillor Chatfield and the Ward Forum will be sending out the information about these to you. These are chaired by Councillor Hamilton. I join them, as well as doctors and academics from across the city. We give a short presentation, and there's about an hour of questions where people get to ask anything they want about vaccine. So do join those, because it's a good way of getting really up-to-date information on the vaccine rollout. So finally, on to the situation in the ward, and I'm just getting up my notes on this that my team pulled for me today. So what we're seeing at the moment in the ward, in comparison to the rest of the city, Weoley Selly Oak ranks about 16th out of 69 wards in the city in terms of the case rate, where first is the highest and 69th is the lowest. In the week of the 13th of February, so between the 7th and the 13th of February, there are 46 cases in the ward, and that gave us a case rate of about 192 cases per 100,000. And in comparison, the overall rate for the city at the moment is running at 215. So you can see it's reasonably high, and sitting about kind of to the upper end in terms of the overall pattern across the city. When we looked more detail what was going on in terms of the demographics in the ward, about a third of new cases over the last month up to the 13th of February were in the 30 to 39 age group. About a third in the 40 to 59 age group, and just under 18% in the 0 to 19s. So the vast majority of cases were between 30 and 59. So that kind of working age, early to middle-aged age group is where the bulk of cases are. And we look at ethnicity, the vast majority of cases, over 63%, are in the white ethnic community, which I think very much reflects the demographics of the ward itself. Compared to Birmingham in general, for the ward has a slightly lower proportion of cases amongst 20 to 39-year-olds, but a slightly higher proportion of cases in the 40 to 59-year-old age group compared to the average for the city over the same period as well. And we're not seeing significant situations, so we're not seeing significant clustering of cases in the city at the moment around particular institutions. So the key message is keep on with the hands, face and space. Keep the windows open as much as you can. Ventilation really helps. We are seeing numbers coming down, but I think it will be a slow and steady relaxation as we come out of lockdown, and much more cautious steps by government to try and avoid us doing what happened in November, as we came out very quickly and 6 weeks later we were going back in again, and government really want to avoid that this time. So it'll be a much slower, I think, opening up as we go forward. So I hope that's a reasonable overview, and happy to take any questions, Councillor.
Thank you, Justin. As ever, very enlightening, very interesting. There's a couple of questions in the chat, but can I just ask one myself, if that's all right? Just around schools and whether, because obviously schools are open and there are quite a few children in schools. I don't know the exact percentage, but it is a reasonable number. I was just wondering whether there's any evidence of an increase in cases associated with those children being in school, or can we not, is that too big a question to answer?
So what we saw back in November when the Kent variant first appeared is we saw a real rapid increase in cases in schools, actually much higher than we'd seen previously. And the Kent variant, which is one of the variants of concern, does seem to be much more infectious in children than the previous version. It's kind of like last year's COVID didn't do much with children. This year's COVID really does. And that's why schools did have to close. What we're seeing in schools at the moment is very small number of cases, but there are, although in Birmingham as a percentage there's still quite a large number of children going to school, in any one school it's a lot less than normal times, so the children are much more spread out, and they're able to be much better at the social distancing. My hunch is, and this is crystal ball gazing, is that when government reopens schools, it will be on a much tighter control of what percentage of children can be in at any one time. And the schools will need to balance that. And we may well see different year groups on different days, because with the new variants that are more infectious, schools have to work even harder to try and stop the spread. The good news is the new variants don't put children in hospital. They don't seem to make children particularly sick. The problem is those children go home and they give it to mum and dad or granny and granddad. So that's why I think there'll be a much more cautious approach. But we're not seeing any great issues with the children in school at the moment. And I think that's down to all the hard work the schools are doing to keep them safe.
Thanks, Justin. OK, so question in the Q&A. You said antibodies wear off after 4 to 5 months if you get the virus. And if you get vaccinated, you develop antibodies. Are vaccinations long-term solutions like the polio vaccine, or do we need regular boosters? Yeah,
really good question. So the way I'd kind of describe this is it's a bit like, think of vaccination, it's a bit like giving your body an exam, because it's teaching it to defend itself. And natural infections, a bit like doing your revision at home, gets us some of the way, but it doesn't really lock the information in. If we do one exam in a subject, we get pretty good. If we do 2, we get really expert. So, do GCSE maths, you can just about cope with equations the rest of your life. Do A-level maths and it comes back straight away. And that's why we have 2 doses of the vaccine. And many vaccines are like this. You need 2 doses to really get to that expert response. And because we have those 2 doses, actually the response, our body learns how to do this really robustly, and that may well last a lifetime. Where we might need boosters is if the virus continues to change. And that's the reason with the flu jab, we have a different flu jab each year. It's not because the jab isn't good enough. It's because the virus keeps changing. So each year we in effect need a new injection. With coronavirus, what we're seeing with the variation is it's not significant enough that we need a brand new vaccine, but we might well need a booster that would take into account some of the small changes. So we'll know more about that, I would expect, in the summer. And it may well be that after we've had the 2 doses, we need an annual booster against coronavirus to take into account these variations. But at the moment, the vaccines all work. The booster is more about taking into account some of the small changes that are happening to just reinforce that infection, that protection.
Thanks, Justin. Not seeing any other questions. Can you just, we have got a lot of people who are very active in the community in the meeting tonight, as you'd expect. Do you want to give us a little quick overview of the community champions role? And I'm sure there may well be some in the room already, but it might be worth, if anyone wants to sign up, I think it's a great scheme. So.
Yeah, no, really helpful prompt, Councillor. I think at the moment, let me just check my numbers. So at the moment, you've got 9 COVID community champions in the ward. That's kind of lower middle numbers. We've got some wards that have got 20 and 30 champions. So that's the challenge to you guys, is please do sign up to join the COVID Champion Scheme. The COVID Champion Scheme is about us giving information to you to share with your family, with your friends, with your social networks. You know, we all know the power of WhatsApp and Facebook, you know, that all this stuff gets shared. And what we're trying to do is work with COVID champions to make sure you have accurate, up-to-date information from me and my team. It comes directly from my team. So you get the facts. So you give people the truth rather than random stuff off the internet. The champions get a weekly data briefing which shows you what's happening in your ward compared to the other wards of the city. There's also some text message information that comes out, and then every week there's a live Q&A session, a bit like this, but it goes on for an hour with either me or my team, one of my senior team, where you get to give us a grilling and go, explain this. This is a question I got asked by my mate and I don't know what the answer is. So it's a real opportunity to get the facts into your hands and give them to people you care about most, and get them the truth, because there's too much fake news going around. So the COVID champions are a really important part of trying to challenge that. We're over 700 champions to date, which is brilliant. And we're doing some new work with the champions at the moment around testing and helping helping us understand about how we can be better. So the other key bit of the champions is it's a two-way thing. It's not just here's the information, give it out. It's also please tell us how we can be better and how we can improve. So help us get better at this and sign up to be a champion. And I put the link in the chat box for people. But to join, it's free, it's lots of fun, and it's a great way to protect the people you care about most.
Thanks, Justin. Thanks, Justin. That's really helpful. I say it's a really good scheme. Really encourage people to sign up. But we'll circulate. If you put the link in the chat, we'll get it circulated out as well via Kay, so people can look out for that. I'm not actually seeing any more questions. Obviously, your presentation clearly answered everything anyone might want to ask. So thank you for the time this evening. Keep up your good work, and all the best to your team. Thank you.
Great. Thank you very much. Good night, everyone.
Okay, so we're going to move on to the next item on the agenda, which I think we've got clean air zone, and I'm just checking to see if we've got I think this is Gemma. Gemma, hi. So I'm just going to hand over to Gemma a second. Gemma's going to talk about the clean air zone, which, as many of you are aware, is the scheme starting up in the city centre shortly. She'll give more details, but obviously it's important. A lot of residents, obviously, in Weoley Selly Oak use the city centre regularly, so I thought it'd be a helpful opportunity for them to find out exactly what's happening, because there's been a lot of press coverage about it, but just to make sure that everyone's clear about what is actually happening in the summer.
Thank you, Councillor Chatfield, and thank you for having me along tonight. As mentioned, there has been a lot of press coverage and not all of it is always accurate, so it's great that we can come along and talk about the facts. So if it's okay with you, I've got a quick presentation that I'll run through. So I'll just share my screen now. Okay, so I'm hoping you can all see that. Okay, brilliant. I'm getting a thumbs up, so that's always good. So my name's Gemma Callow. I am the Communications Manager for Bunbury's leading on stakeholder engagement for the Clean Air Zone. So I'll just give you a quick overview now of how it's going to operate and also the support that's going to be available. So this shouldn't come as a surprise to anybody, but the Clean Air Zone is being introduced to tackle dangerously high levels of air pollution. This is having a detrimental impact on our health and has been declared a national health emergency by the government. I've got some stats on screen. I won't run through them all with you, but some of the key points: there's up to 900 people in Birmingham every year who are dying earlier than they should from conditions linked to air pollution, such as heart disease, cancer, dementia, etc. People who live in the most deprived areas and the vulnerable are most impacted. And I think what's also really important to stress is that our children are inhaling 3 times as much air pollution as adults, purely because they're closer to the ground, closer to those exhaust fumes, and therefore that's impacting on their growth and their development. So pre-COVID, we looked at behaviour habits of people travelling into the city centre, and 50% of all journeys into the city centre were undertaken by car. And what we found to be quite startling is of those journeys, 250,000 of them were less than a mile every day. So that's a 20-minute walk. So in delivering the Clean Air Zone, we are looking at getting rid of those high polluting vehicles, but also looking at how we can get some of those shorter journeys out of cars and into foot, bicycles, public transport, etc. That's better for the environment and better for people. So Birmingham's Clean Air Zone will go live on the 1st of June this year, having been delayed previously from January last year and summer last year. We will be the second Clean Air Zone outside of London to launch. Bath will go first, and they're introducing Category C. In Birmingham, we're introducing a Category D Clean Air Zone. So it's important to stress that a Clean Air Zone is not the same as a congestion charge. We will only charge the most high polluting vehicles. London has a congestion charge where every vehicle is charged to enter an area. Ours will only be those who don't meet those emission standards. Because we're a Category D, that will include private vehicles. Bath, being Category C, has chosen not to do that. Each local authority has it within their control, and Birmingham decided on a Category D. We will be the second Clean Air Zone to launch. We will not be the last. There are many coming up behind us. So the Clean Air Zone will be everywhere within the A4540 middleway, but not the middleway itself. So you can see that blue area there on screen, that is the zone. So if you're in a compliant vehicle, there's nothing you need to do other than consider a more sustainable form of transport. But in terms of the Clean Air Zone, there is no action you need to take. If you are in a non-compliant vehicle that is subject to the charges, you can drive around the A4540 middleway, no problem. But as soon as you enter, we'll have ANPR cameras that will pick you up, and you'll be subject to the daily charge. That charge is £8 a day for cars, taxis and vans, and £50 a day for HGVs, coaches and buses. Again, I stress it is the non-compliant ones, which we anticipate will be about 1 in 4 vehicles. So if you do enter the zone in a non-compliant vehicle, then you will need to pay that charge. So you will need to pay online or over the phone using the government payment system that will go live shortly. You can pay 6 days before you go in, the day you go in, or 6 days after. So you've got a 13-day payment window. But if you don't pay within that time, then you will be subject to a fixed penalty notice of £120. It's important to stress that we are installing 300 signs around the perimeter of the zone, around the approach to the zone, to warn people they're approaching and are going to enter. But there won't be any other notification. So it'll be the same as London. You won't get a text, you won't get a letter. The onus is on you as a driver to know that you've entered. And that's why we're having these engagement events, to make sure that people are aware. I should stress that the charges are run from midnight to midnight, not 24 hours from when you enter the zone. And during that midnight to midnight, you can enter and leave as many times as you want for a single charge. But if you cross the midnight threshold, so enter at 10 p.m, leave at 2 a.m, you've crossed that midnight threshold and would therefore be subject to 2 charges. So the big question, will I be charged? So the best thing to do is to go to the Bunbury's website, and we have a link to the National Government Vehicle Checker where you can go in, input your registration details, and it will tell you whether or not you'll be subject to that charge. What we are looking for is to meet certain emission standards. So if you have a Euro 4 petrol or better, a Euro 6 diesel or better, you won't be charged. Nor will you be charged if you have a gas Euro 6, fully electric, fully hydrogen fuel cell, or a hybrid electric that meets those standards. You can find that information in your logbook, your V5C. But as a guidance, and I must stress it is a guidance, most Euro 4 petrol vehicles came into circulation from around 2006 onwards, and most Euro 6 diesel from 2015 September onwards. So most vehicles from those dates should be compliant, but I must stress you should go on the vehicle checker to check that for yourself. I'll whiz past these ones, but it's important to stress again that the clean air zone is not about making money for the council. This is about tackling air quality, and if we make no money from the zone, then we've achieved our objective because there are no high polluting vehicles passing through it. However, we do know that it takes time for behaviours to change. So with the money that we do expect to make from the zone, we will use it to fund some of the policies on screen here. It has to be transport related projects and policies. It can't be spent on things like the floozy and the jacuzzi, propping up bin collections. It must be spent on policies that will encourage cleaner, greener travel, sustainable active travel. So some of the projects identified are controlled parking zones around the A4540 middleway to stop people parking their cars on the outside and walking in, causing problems for residents. Funding for a hydrogen bus pilot, city centre pedestrianisation, and active and sustainable travel, so bus and cycle lanes. We do know that this is going to cause some disruption, shall we say, but like I said before, it's a national health emergency. We're in the midst of a respiratory pandemic. We all need to take action. So those who are most affected will be eligible for some support. They've been identified as residents. So if you live in the zone and have a non-compliant vehicle, you can apply for a temporary exemption for up to 2 years from the date the zone goes live. You can apply for that now. Applications are open. Probably more relevant to this call are those who live outside of the zone but work within it. So you can apply for a worker exemption if you live outside the zone, own a non-compliant vehicle, and work at least 18 hours a week at a premises within the zone and earn less than £30,000 a year. It's important to stress that the name of the employee must match the name of the owner of the vehicle. So if you drive a partner's vehicle or a family member's vehicle, you wouldn't be eligible. Other exemptions that are available are for commercial vehicles registered within the zone. They also can apply for a year's exemption. And for people visiting the Children's Hospital, Badger or Atwood Green medical centres that all offer 24/7 out of hours care, there'll be a voucher system being introduced where people in non-compliant vehicles can collect a voucher from reception, and that will avoid any charges. Other exemptions that don't need to be applied for, that are automatic, are motorcycles, show vehicles, historic vehicles over 40 years old. These can't be retrofitted. Specialist vehicles like the emergency services and recovery vehicles, communities and school transport, so like your ring and ride, and also vehicles with disabled or disabled passenger tax class. That's tax class 85. It will be in your V5C logbook, but is not the same as a blue badge. So that classification is available for people in receipt of certain benefits. You can check that on the DVLA website, and if you think you qualify, you can phone up and request for that classification. There are also some financial incentives available. So Hackney carriage drivers, we've got a £15 million pot of funding to help them with grants to upgrade, retrofit, lease compliant vehicles. SMEs based in the West Midlands with HGVs can apply for a share of £10 million of funding to upgrade, retrofit, lease compliant vehicles. And then probably again most relevant for this call are those who work within the clean air zone and meet that criteria earlier, as well as a few extra terms and conditions, could apply for our scrappage scheme. This will open in the spring, and what it means is if you are that registered keeper of a non-compliant vehicle, meet the relevant terms and conditions, you can apply to us to scrap your vehicle, and then we will give you £2,000 towards a compliant vehicle. That doesn't need to be a brand new vehicle. Again, it's that Euro 4, Euro 6 standard. or £2,000 towards mobility credits such as a Swift card to use on public transport. That scheme opens, like I say, in the spring, but you can register an interest now by signing up to the Bunbury's newsletter, so you'll be notified as soon as it goes live. And just to touch upon this quickly, the clean air zone is one piece of a much bigger puzzle that Birmingham City Council are looking to do to improve the city centre and make it cleaner, greener and nicer for everybody. So the transport plan will be the next phase, which is looking at reallocating road space to give priority travel to public transport and sustainable active travel. And some of the points raised on screen here, I won't go through them all, but managing parking demand so that there's no free parking within the clean air zone to disincentivise people from travelling in their cars. And finally, we've obviously got the Route to Zero programme as well, which is where the council is set to become net zero carbon by 2030. And again, the clean air zone plays a key part in the journey for that. Again, I won't talk through all of this as it's the clean air zone you're mainly interested in this evening. So that's everything in a nutshell. What I would stress is to go on the Bunbury's website, firstly, and check if you'll be charged. If so, then check to see if you're eligible for an exemption and apply now. At the moment, we are turning those applications around very quickly. As we get closer to launch, we will get busier, and until you receive confirmation, you will not be exempt. So we would urge that you apply now, get it sorted, and then you're ready to go when the zone goes live on the 1st of June. Thank you.
Thank you, Gemma.
Thank you. I hope that helped.
That was brilliant. Thank you so much. Really, really informative. I have got some questions, if you're okay, for a few minutes. Particularly if you've had the chat. First one up is actually from my colleague, Councillor Johnson. Just would like a copy of the slides.
No problem.
Excellent. Thank you very much. And the first question up is why is there no reminder system in place?
There's no reminder system in London either, but what we will do the month before we go live, so in May, anyone who passes through the zone during the month of May will receive something in the post to say from June you will be subject to charges. It's the same system that's in operation as in London.
And next one, do you think the ring road can cope with the extra amount of traffic using it?
Like any new scheme, there's going to be growing pains. I think we need to be upfront and honest about that. There will be initially that moving of traffic, and we will be monitoring that closely, not just in terms of congestion, but in also terms of air quality to make sure we're not dispersing the problem wider. Like I say, though, there are a huge amount of journeys every year or every day that could be undertaken in alternative ways, which we're hoping this will trigger that action. And I think the other thing to take into consideration is COVID. And we were all expecting the new normal to not be as it once was. We're expecting a lot more home working, which will reduce capacity on the roads in that sense as well. But it is something we will monitor very closely.
Great, thank you, Gemma. There's one I think you've kind of answered actually, which is the next question, which is, will there be monitoring of communities living outside of the zone? I'm concerned about children living on the outskirts.
Absolutely, yeah, like I mentioned, we will be doing that. The council also has the air quality action plan, which is going through the final stages at the moment, I believe, and that looks at air quality across the city as a whole. So when they were looking at introducing the clean air zone, that inner city centre area had the highest levels. That was what was agreed to address first, but the air quality action plan takes it further and looks at addressing the problem across the whole city. So it doesn't just stop there.
Sorry, just keeping an eye on that. So I'm trying to do three things at once.
That's okay.
Okay, last one from Anne. Why are speed cameras on the M being used to control clean air by changing speed limit? Oh, motorways, I presume. Why are speed cameras on the motorway being used to control clean air by changing speed limit?
I'm not sure I can answer that. To be honest, I'm not sure I entirely understand the question, so apologies there, Anne. But the motorways are not owned by BCC either. That's Highways England, so that would probably be a question more directed at them. I hate not being able to answer a question, but I don't want to make up an answer just to appease people, so apologies, Anne.
No problem. If Anne, if you want to drop myself an email, I'll pick it up with the highways department, or just try and find the relevant person to pick it up with. That's great. Let me see. I've got another check if there's something coming in. I think it's another question on the reminder issue. I think just because London does it doesn't mean. I think essentially just because London does it doesn't mean that we have to do the same. So it might be worth just clarifying what the I suppose what the difficulties would be to have a reminder system.
I think probably, again, apologies, I'm probably not best to answer this question, as it was a decision that would have been made by politicians and councillors, but I imagine costs would have come into play. This is not something that's going to be running short term. There's going to be long term and costs involved. I can certainly take away the contact details for that person asking the question and get a comprehensive answer. I think that would be the fairest thing to do, rather than me trying to second guess the reasons for that.
Thanks, that's fine. We'll put you in touch and you get a proper answer. That's brilliant. I'm not seeing any other questions. Could you just I probably missed it because I dropped off at the relevant. My laptop crashed probably exactly the wrong moment. Can you just remind what the exact date is that the scheme is going live?
Yeah, it's the 1st of June this year, so it's just over 100 days. It's 100 days from Sunday until we go live.
Brilliant. Okay, I'm not seeing any other questions. So I think, as I said before, if there are any other further questions that occurs to people after this, please just drop them either to myself or Julie, and we will pick them up with the department and try and get answers as best you can. You know, it is a government mandated project. It may not have been exactly what we would have chosen to do, but I think in terms of the broad emphasis in terms of reducing air pollution, protecting those many people who do get seriously ill and pass away in our city as a result of air pollution, I think the direction of travel is certainly the right one. And I know there's a lot of people in this meeting who share sort of my enthusiasm for alternative means of transport and getting us out of private cars, not least because, quite honestly, if you remember the pre-lockdown days, it's starting to get pretty difficult to actually get around Birmingham in a car. So actually, just practically, I use the train and the bus myself, and quite honestly, most of the time it's a lot quicker, especially the train. If you're lucky enough to live near a train station, like we have the Selly Oak train station not far from us, really handy and very quick way to get into the city centre, and I have to say far better than driving. Okay, everyone, thank you very much. Thank you, Gemma, for your time this evening.
Thank you very much for having me.
Appreciated. Thank you.
Thanks, Gemma.
Bye.
Bye-bye.
Okay, so the next item up is on the census. So I've got something to read. You're going to have to bear with me for a couple of minutes while I dig it out, because I said my laptop crashed in the meeting, which means I no longer have what I wanted to hand. So I'm afraid, Julie, will you fill for me for 2 minutes? Talk about.
I've got it printed out here if you want me to read it out.
Give me 2 minutes. Have you got it in front of you?
Yes.
Oh,
yeah.
well, you go ahead.
Do you want me to? I'll read it. It's about this is the year of the census, with Census Day being on March the 21st. The nationwide survey only happens every 10 years, but it's important to take part because it helps us decide how services are planned and funded in the local area, from doctors, surgeries to bus routes. It gives us the most detailed information we have about our society, and getting accurate data is important to help millions of pounds be invested where it needs to go. It even helps charities and voluntary organisations supporting their funding applications. So every household will receive a letter from early March with an online code allowing them to take part online, as it is primarily digital, but people will get details on how to request a paper copy if needed. There will be language, digital and accessibility support available for everybody who needs it through the Census Support Centre, phone lines and online help. So Census Engagement Manager for South Birmingham is a lady called Alison Brinkworth, and she wants to hear from anyone who can help promote useful information about the census in our community, such as on Facebook pages, newsletters, etc. And if you've got a job that involves being able to reach elderly or those that we think the census might not be able to reach in these current times. So there's posters and leaflets in a variety of languages to send out on social media, all ready to go. if you would like to contact us to be part of that. We've got her details here that we can pass on to you, her email and her phone number. I'm not sure if we want to read that out or not, but I can. So a reminder then that Census Day is March the 21st this year, and that is a Sunday, March the 21st. That's what I've got on this brief here, Tristan, to read. Back to you.
Thanks, Julie. No, so that's really helpful. I'm just going to, if there are any questions, please do put them in the post, put them in the Q&A section. I suppose from our perspective, ultimately, this is about making sure that government has a proper idea of both the population, but also the sort of issues we have in our communities. So it's really, really important that people do fill in the census form accurately and on time. That way we can make sure that people don't go missing, and therefore we get the resources we should get from government. Because if we don't, if we have underreporting, then quite simply put, Birmingham will get less money. And that will apply to everything, not just the council, but it will apply to the NHS, it will apply to transport, all of those things. The government work off the census figures. So it's really, really important that we get the accurate numbers. I'm just checking to see, I can't see any new questions coming in, but if there is any, again, Alison's put all her details out there, so we can put it in the chat or we can pick it up separately. It is really important, and we did want to have this opportunity to sort of raise it. There's also, as Alison points out, there's also Twitter feed. So if those of you are on Twitter, there is @Census Brum South, where you can pick up news information about the census. It's also worth pointing out there are, and I think last time Alison might want to confirm this in the chat, but there were some jobs available with people supporting the census. So if people are looking for employment, or you know someone who's looking for employment, this might be a good opportunity to find some work, especially at the moment, as obviously a lot of people are struggling out there. A lot of people have lost their means of employment. So if anyone in Weoley and Selly Oak is interested in a bit of work, then the census might be a really good place to start. Can't see anything else. So what I'm going to suggest is we move on to, should we move on then to Councillor's report? I'm going to bring Julie back in just to do a quick update on what's happening locally. Then I've got a couple of bits, and then hopefully we'll have a little bit of time left for some questions, and then we can see if we can get finished off by 7 o'clock, so everyone can go off and enjoy their pancakes if they haven't already done so.
Thanks, Tristan. Locally, although we are obviously under the COVID regulations, we are both still available, and we are getting a lot of casework still through social media. If anybody does need to contact us, then please do email us if there is something that you have a concern about in the community. You can contact us, and our details are available on the website. We get an awful, or I certainly get an awful lot of emails about rubbish that's been left somewhere, or not quite so often at the moment about missed bin collections in the ward. But anything that you think that we might need to know about that's happening whilst we're not able to do as many walk around the areas, obviously because of the circumstances, then please, you're our eyes in the community at the moment. Please let us know what is concerning you. And also, if there are any improvements that you think might be good for the area, let us know. We keep lists of things that people suggest. We don't just press delete on the email. We do keep what people tell us and take note of that. So please bring all of those things to us. And there has been some recent changes about fly tipping, for example, and we will post some more details about some recent changes to fly tipping and what the council are doing in a hope to try and stop a lot of that happening in our wards and throughout the city. That really is probably all I'm going to say at the moment. There's in terms of our usual community events at the moment, of course, they can't happen, but hopefully as lockdown stops, we can try and introduce some of our community events again, perhaps later in the year, but that's of course down to how and when lockdown ends for us all. But I'll finish there and hand back to Tristan. Thank you.
Thanks, Julie. We have had a few questions in, but just a couple of sort of appeals first, if I can. One of them is around policing. Had an interesting conversation via email with Nick, who is our new inspector for Selly Oak. And I think the police are looking for kind of areas that might be of concern as lockdown eases. So I think the worry is that as people, emerge back into the daylight, so to speak, there is potential for some increase in policing issues and crime. And really, I think quite credit to the police. They want to have a conversation about that before it happens. So if anyone does have any particular concerns, please let us know again, and I'll pass those on to the police. A couple of issues that I fed back on. One of them is around bikes, motorbikes, quad bikes. It's a perennial issue, but I expect as lockdown eases, we'll unfortunately see an increase in that again. And the other one was around speeding cars. That again is a perennial problem. But again, as lockdown eases, the amount of traffic increases on the roads. It's fairly likely that we're going to see an increase in speeding cars as well. But we'll try and get the police to one of these meetings. It's a little bit tricky because they're an external body, and we've seen from Alison's issues around the census and highways last time, it can be tricky to get people on. But we'll try and get some feedback from the police if we can to the next meeting. But I think it would be, in the meanwhile, if people do have any concerns about what happens kind of post lockdown, please do let us know, and we'll pass those on to the police. So we have had a few questions. I'm just going to start at the top. Give me a second. So Anne, hi Anne, asked a question about what is happening in the ward with SIL money has been generated from developments in the Selly Oak Ward. I'm sure many of you probably know this. I have quite a few informed people on the call, but SIL is the sort of contribution, community infrastructure levy that is a contribution from developers to the local community where a development is happening. The majority of it goes to the city to spend on big city schemes, big city projects, but some of it is retained locally. And there's only about 3 or 4 wards that have any kind of significant amount of SIL funding due to them. And Selly Oak happily is one of them. So there will be an opportunity. We've literally, I think the policy has only just been gone through the process. So it's only just had that community policy. So what I'll do is I will take that away and have a conversation about what the process is to looking at what happens with those SIL money. But it is a good opportunity for us. So it was something we're intending to bring to a future meeting anyway, and sort of just preempted that. It's a new thing. None of the communities have yet spent any of their SIL money. It's only been in operation for a couple of years. So the amount of money for Selly Oak is still relatively small. It's only really Ladywood that has large sums of money because of its city centre location. The only, just amusingly, one ward's got £37 in its bank. So I don't know what they're going to spend their 37 quid on, other than perhaps a round of sandwiches. OK, so the next question we've got a couple about the budget. I will come back to those, Martin, if that's all right. Let me just get this up. At our last meeting, the fly tipping outside Kennedy House was mentioned. It was cleared, but whoever did a very bad job. There is still lots of rubbish there. Too much of residents to this pit. Can councillors please press this area to be cleaned up ASAP? The rubbish has been there since since summer, early autumn, despite being formally reported to the council on multiple occasions. As the plants grow in the spring, it'll become increasingly difficult. Yes, Anonymous, I share your frustration about this particular site. I know both myself and Julie have reported this. I've been down, had a look myself, reported it, photographs, reported it. As you said, it was cleared, but sadly, partly because you're right, some was left behind, but also because people then come along and dump more, which is unfortunate. There is and we'll keep on to it. The intention was, and we had it arranged, a date in the diary in early January, was to bring John O'Shea, who's the cabinet member for Clean Streets, down to come and have a look at some of the issues we've got, especially around there and the footpath through to the old Lapel Canal footpath through to Selly Oak Park. My intention was to bring him down there, perhaps with a couple of local people and have a conversation. Unfortunately, that all got unfortunately, I had to get put off because of this lockdown we've entered into. But we will pick that up straight away once we get out of lockdown. There is some good news, though, in that there was a report gone through council through what we call scrutiny committees, which is sort of backbench councillors and their chance to sort of challenge what the cabinet are doing. And there was a report, a really good report on fly tipping, and there's a number of actions that come off the back of that. Some good stuff around looking at increasing CCTV provision, which I think is something a lot of us have been talking about for a really long time. So it'd be really good to get some of that in. Also some stuff around name and shaming. So Barking and Dagenham Council have a sort of really robust system whereby every month they have a wall of shame on the internet, and they broadcast it. And it's obviously on council documentation and things where they name and shame people who have been caught fly tipping to help try and identify them, but also send a message it's not acceptable. That's something else we're looking into, as well as increasing the resource to pick up fly tipping. And I think the last really exciting proposal in there, I think there's some work to do yet in terms of money, but it is around having returning to what, I don't know if anyone remembers them, but we used to have sort of ward enforcement officers based in the ward doing loads of sort of green and clean stuff that really helped make a difference in our wards. I just about caught the back end of it when I was first elected to the council, and the one we had was fantastic, but then it was all cancelled because of money and austerity and all that. But we're trying to find a way that we can bring that back, and I think that'll be really welcome. It might not be one for every ward, but I think on a trial basis we're going to try it in the worst hit areas and then see if we can move it out more generally. So just personally, I think it'll be absolutely fantastic if we can get that, but might take a little time to get it resolved. I'm going to bring Julie in now. Julie?
Yeah, I just wanted to mention about the issue about the fly tipping that we referred to at Kennedy House and down that stretch of area. I think part of the difficulty we also had, and which is why we wanted Councillor O'Shea to come out, is to try to establish who's got the responsibility for which part, wasn't it? Because I think some of it is parks, some of it might be the council, some of it might be somewhere else. So we wanted to establish whose responsibility it was and determine that. So it'd be great to get a kind of a site visit as soon as we're able to do so that we can have this as an area that we keep an eye on for the future if anybody else is, you know, thinking of fly tipping and dumping stuff down there, but also that if anything does happen, we know exactly who to report it back to. Thank you. Thanks,
Julie. Okay, so we've got a couple of questions. Oh, actually, one good point actually is that Bourneville Village Trust are consulting on, let me just get the right title for it. Sorry, one day we'll get back to normal meetings again. Much more civilized. The design guide, that's right. So BVT are consulting on the design guide. The deadline for that is the 28th of February. So if you are a BVT tenant, would strongly recommend you take a look at what those proposals are, because obviously it will affect you as a homeowner. Couple of other questions, if I can, on the budget. So we've got equal pay is mentioned each year in the BCC financial plan. How much is the liability and when will it be paid off? And I will email you more details, Martin, if I can. But in summary, give or take, the figure is over, and you probably want to hold on to your seats if you're not sitting down. The figure is well over £1 billion of equal pay liabilities that we have either paid off or need to pay off in the foreseeable future. The vast majority of that has now been paid off, but there is still some outstanding, and there are still new claims, believe it or not, coming in all the time. Some of which have more gravity and have more chance of success than others, and as they come up, the council tries to settle those, but there is a set of money has been put aside to cover those off. There's a limit to how much you can say in public, obviously. It's a very confidential and sensitive area, obviously, but it's a big financial challenge for the organisation. But we are, in terms of the amount we owe and how much we have to pay back, we are moving through that process and are hopefully getting towards light at the end of the tunnel. And then the next question from Martin around the budget was around BCC financial plan 21-22 mentioned savings. When will the details of these be announced? I say they'll be announced. They are in the paperwork. They're not cuts per se. They're not cuts that will have an impact on the front line. the savings for next year are almost all driven by what's called the establishment, and it's a horrible term, but essentially it is about managing, reducing the number of vacancies held in the organisation, but also reducing agency cost. By doing both of those things, we should be able to make some savings, and those are included in the plan. There are no what you and I would understand to be cut. So things like libraries, park service, all of those kind of stuff, street cleansing, all of that will have the same budget next year as they did have last year, with some bit of more money to cover off increments for staff and various other things. So there is the budget for next year is static is the wrong word, but it's quite it's solid for next year in terms of the impact on communities. It's going to full council next Tuesday, so that forget the date, but towards the end of the month on Tuesday, the last Tuesday in February, it is going to full council and hopefully be approved. But as I said, there aren't any direct cuts that should impact on communities, so that at the very least is quite positive news. I'm just going to scroll through, see if there's any more questions. Simon, there was a skateboarding in Sainsbury's underground car park in the evenings. Yeah, I was actually aware of that. I know the police have actually, pre-lockdown, they were conducting some enforcement stuff around there, and I think a couple of young people found themselves in a bit of trouble over that, for a bit of antisocial behaviour that's down there. So if it's still occurring and it's still an issue and it's causing, I mean, if they're causing bother, then we need to do something about it. If it is kids skateboarding, we need to look after their safety primarily, I would say, more than anything else. But as long as they're not causing issues, then it's okay. Where they step over the line, though, the police are aware, and we will of course report it to the police, and they will take action. Over last summer, there was a community safety order in place covering the Selly Oak shopping centre to try and prevent some of that antisocial behaviour. But obviously, again, lockdowns had an effect on all of that. But I would anticipate, again, we'll see more of those kind of issues. And if it is antisocial and it's causing problems for people, then please do let us know, and we'll let the police know. Also got a note from Cheryl, just something going on at BVT. Could you mention the BVT Well Winter campaign? We are helping residents living in our homes and managed areas stay fed and warm over the winter months. This scheme is running up to the end of March. That's in the chat. There is a website link there. That sounds like a really, really positive scheme. I know BVT do a lot of good work in the area. We work quite closely with BVT. They do some fantastic stuff. So if you are struggling or know someone who's struggling that's a BVT tenant, please look up that website and see if they can help you. Got one more coming in. COVID issues. I've just got from Simon. Simon, I don't know if you want to be slightly more specific. We did have Justin earlier. Just wait to reply. I'm just responding to your previous one as well. Just in terms of Frederick Road, I've actually had a response. Literally came in yesterday, so I will get that over to you once I've had a chance to check it and read it and make sure it's okay. And I'll send it straight over to you, and then we can see what we can do about Frederick Road, about the payments. There are a few issues there. I don't know, Julie, do you want to mention the triangle planning application? Might be worth mentioning.
I'll only mention it in what I can in terms of me. I sit on the planning committee, but the triangle, the student development for what was the old Sainsbury's at Selly Oak was before planning about 2 weeks ago, I think it was now. And it was for about the third time. But it was refused. I'm sure that it will potentially go to appeal, but for the moment it has been refused. It was for a development of about 1,200 student apartments, 12 stories high. I won't go into the details because it's all online if anybody wants any information. But it would be interesting what happens going forward with that space and anything in the future if it does come back to us for appeal. But that is the current state of that application and that area at the moment. I know there's been lots of people discussing what they would like and what they wouldn't like there. But that's the current situation with there. Thank you.
Thanks, Julie. It's an issue of quite a lot of concern, and we'll have to wait and see whether they appeal or not. But I'd be very surprised if they didn't, in all honesty. So just on one other planning issue, an application for a HMO, a large HMO on Goss Croft in Selly Oak was actually refused, which I think is very pleasing. So that's and it didn't even go to committee; it was just refused there, sort of at the officer level. So that's very pleasing. Quite strong arguments were made against it by residents and myself. So I was absolutely delighted when they refused it. And essentially, the grounds for refusal was the loss of a family home, which is the thing that I think as councillors we've been banging on about for a long time with residents. Yes. So I'm really pleased that actually we've got an example now which we can use and say, look, that we know we're losing family homes in Selly Oak. We need to keep family homes in Selly Oak. And actually, this is actually a really good example of the planning system actually working to the benefit of residents. I think it's really welcome. Again, they have the right of appeal. I don't know whether they will or not. They may just come back with different plans. So we'll have to keep an eye out for that. But given the scale of it, I think it was a 6-bedroom HMO was proposed in what was a fairly normal sort of parlour house style housing, if anyone knows that road. So as I said, really pleased it's been kicked out, but we'll have to keep an eye out and see if it comes back again.
Can I just very quickly say that I thought I saw it in the list of planning things that came through to us as councillors, but I have a feeling that there's a potential application coming out for a 5G mast on Weoley Park Road. But we'll circulate that for people to look at and make comment on. But that only came out in the last day or two. But I'll double check and get that circulated on the usual platforms for people. But people, please comment more so to Tristan than myself, because I'm on the committee if it comes to me. Thank you.
Yeah, that's right. So Julie has to be a bit careful just because she's on the committee. It's helpful to have insider knowledge, but as I said, she's on the committee, so she has to be careful what she says publicly. Otherwise, she won't be able to take part in decisions. Obviously, we want to keep Julie in there, helping make good decisions for us and for the rest of the city as well. I'm not seeing any other questions. It is gone 7 o'clock. I think it really just leaves it for sort of me and Julie to say thank you all so much for coming this evening. Any issues, please just drop us a line and we'll pick them up. It is really busy at the moment, so if you don't get an instant response, apologies, but we'll try and get back to you as soon as we possibly can. And I'll bring and so thank you everyone. Have a good evening. Thank you for coming, and there will be another one of these coming up in the not too distant future, assuming we're still doing things online and not doing things in person. But I really look forward to seeing you all in the flesh once this current lockdown is over and we can get back to some kind of normality. So Julie, last word to you.
Thank you to everyone that's joined us online, and really hope that we're able to get back, as Tristan says, to seeing people in our usual forums face to face and help everybody as best they can, and hope everybody stays safe. Thank you very much.
Cheers everyone, good night. And just I'll also quickly say thank you to Kay and Pat, who are the officers supporting us tonight, who as ever have done a really fantastic job. So thank you everyone, and enjoy your evening.
Thank you.